Okay, since it's after the hour, we will go ahead and start. Good morning, good afternoon, good evening. It is so wonderful to have everyone together to join this call. As you know, I'm Pam Cipriano, ICN President, and I'm just thrilled to be able to welcome you to this webinar. The areas that we're going to cover today are not only timely, but really important as we think about where the world is in recognizing the need to provide healthcare for all. And so our ability to focus on how we can continue to support and strengthen primary health care, which is really the heart of universal health coverage. This is an important time for us to not only share what we know is happening around the world, but also hear the thoughts and activities and success stories from a number of you who will share what's happening in your NNAs and be able to help us think about this very strategic issue that's important to us and important to all the people we serve.
Stratégique importante pour nous toutes, nous tous et nos bénéficiaires. Mais avant tout, je voudrais vous parler du conflit qui perdure aujourd'hui. Et bien entendu, nos cœurs vont à tous ceux qui sont touchés. Nous savons qu'il y a beaucoup de travailleurs des soins de santé, mais aussi des gens de plusieurs pays qui ont été mis à mal, qui souffrent. Et nous avons des sentiments, bien entendu, les concernant. Et nous condamnons toutes les violences à l'encontre des travailleurs des soins de santé, des hôpitaux et des centres de soins en zone de conflit, que cela soit en Ukraine, à Israël, à Gaza, au Yémen, en Afghanistan, au Soudan, au cours de l'année dernière. Et au cours de ces dernières semaines, surtout, nous voyons qu'il y a bon nombre de vies humaines qui sont sacrifiées et que les travailleurs des soins de santé sont mis en danger. Nous sommes partisans des campagnes pour aller à l'encontre de cela. Comme vous le savez, nos deux campagnes, Nurses for Peace et notre fonds, appellent à la paix aux quatre coins du monde et nous condamnons toutes les attaques contre les travailleurs des soins de santé. Nous soutenons tous les infirmiers et infirmières sur le front et continuons à appeler pour le respect du droit humanitaire international et des droits humains qui protègent le droit à l'accès
a la sanidad, sino también la protección del personal sanitario. Por ello esperamos poder ver cambios en nuestro mundo que garanticen que todo el mundo puede disfrutar de seguridad, ya sea personal sanitario o miembros de nuestras comunidades.
Who would like to ask a question during the webinar today, please use the Q&A function. If you have questions that can be answered during the conversation, staff will address them. If not, we will have questions at the end. I'd like to turn it over now to our CEO, Howard Catton, to give you a little bit more introduction about today's webinar.
Thank you very much, Madam President. Good morning, good afternoon, good evening to you all. As always, fantastic that you're able to join us for this webinar. Firstly, just to add to what our President has already said, for those of you in relation to the conflicts that we're seeing around the world, and particularly at the moment in Palestine and Israel, those of you, I think, will have already seen that there was a statement from us with colleagues from the World Health Professionals Alliance about 10 days ago now, and there has been a separate statement from us as ICN reinforcing, reiterating the messages that the President has given. I think also just to say that what we have been particularly struck by those nurses, colleagues who we have been in contact with, that all of them have been affected by personal loss and tragedies and are continuing to do their work to fulfill their professional responsibilities whilst also dealing with grief and fear and their own emotions as well. And we have and will continue to recognize their courage, their dedication, their humanity, and the support from all of us as a global profession. As the President has said, UHC has risen to the forefront of the agenda, again, particularly because the pandemic has thrown the world off course for its ambitions to deliver universal health coverage. And we're going to hear from our President the work that she's been leading recently in relation to UHC and at a UN level. But ICN has been in this space for a very long time. And I will, after the President, share some of the history of the work that we have been doing for a number of years from a policy perspective. And then Michelle and David, our Chief Nurse and Deputy Chief Nurse, will also be sharing some of our most recent work in relation to nursing practice and nursing roles as well. But really importantly, as there always is the case, we wanted to have this opportunity to hear from you, to hear your lessons, your developments, your challenges, your achievements, always incredibly strong and powerful interventions. We are currently working on a new resource which will pull much of this work together, but we're holding off deliberately publishing that so that we can include deliberations and discussions from this webinar. Madam President, back to you.
我进来了，他是要就是通过 email 的链接才能进来。好，行，好，拜拜。
I think you're muted, Pam.
Hi. For some reason, my mute button keeps going off. Can you hear me now? Yes. Okay. Slides are good, right? Okay. So we want to talk this morning to level the understanding of where we are with universal health coverage, both globally as what's been happening at the United Nations, and then more specifically to really understand the advances that are going on. And Cyril, maybe if you can mute people in the background there, if that's possible, since I see several that are still on. Okay. So I wanted to be able to share with you again, our basic premise starts with health being a human right. And we have long believed that, and it's an important part of our agenda. And thinking about where we are with universal health coverage, we have to go back to recognizing that this is a declaration that aligns with the time frame of the Sustainable Development Goals. And so it's important for us to be able to know that as we approach universal health coverage, we need to do this together. And we have to make sure that we are recognizing that this is equity, whether it's all in all forms of equity, human rights, as well as social justice. As you heard or read in our numerous press releases in the last month or so, the United Nations had 3 high-level meetings this year: pandemic prevention, preparedness, and response, ending tuberculosis, and universal health coverage. All 3 issued political declarations at the conclusion of the meeting. What was absolutely clear, however, was that these are all very much related, and the fundamental declaration on universal health coverage is really now seen as the most important pathway to get to pandemic preparedness, to be able to control non-communicable diseases, to be able to also end any kind of infectious disease issues that we're seeing emerge, and again, bring everyone together around the fact that if we're going to cover more people and give them access to care, it is universal health coverage. And more importantly, it is primary health care that must be built in order to achieve UHC. So the political declaration reinforces very clearly governments must make commitments and they must invest. And just as we've seen with all of the pandemic, you can't just talk about it, you must take action. So we're really reinforcing the message that everyone must have access to care, and we must be able to make sure that benefits are providing the funding and investments to make those necessary. Dr. Tedros, again, saying that we've sent a strong signal that we must invest in primary health care, because that is how we will actually be able to achieve the coverage that is needed. Now, you've probably seen this message many times, that when we look at today's healthcare, half the people in the world don't get the care they need. Millions are pushed into poverty, and we have seen the work on UHC slow because of the pandemic. But there's 3 basic principles of UHC. One is that all people receive the care they need, and it is on a continuum from birth to peaceful death. And the second is that the care is of appropriate quality to meet their needs. And the third is that it does not create financial hardship. So those three principles of universal health coverage must be present. We also know that it is the foundation of SDG 3, which the target 3.8 talks about achieving universal health coverage, making sure that we're preventing risk and that we're providing all kinds of essential healthcare services. Now, you'll notice bolded in the list of investments is the healthcare workforce. We know we have to have an effective healthcare workforce. This has been our consistent message at the UN high-level meetings. It has been embraced by everyone who is having these discussions about the most important way to get to universal health coverage and primary healthcare. We have to have a sufficiently skilled workforce. The other aspects of factors required are addressing social determinants of health. We cannot ignore the effect where individuals are not supported because of their financial situation, or that they are disadvantaged and aren't able to get the services that they need. Our systems must be working effectively, they must be accessible, and they must be cost effective. So part of this message about UHC, and I've been, as Howard mentioned, I'm on the action committee for UHC2030. And so we are reinforcing over and over again that not only do we send the message that our workforce is not a cost, it's an investment, but health is an investment. When countries invest in health, they invest in their people. That strengthens their preparedness for any kinds of disasters. It also affects their ability to have a robust workforce. When people are working, we have healthier economies. So the message is coming from UHC 2030 that we strongly support our political leadership for UHC coverage, which means investment, leaving no one behind, making sure that our laws and regulations support UHC, a stronger workforce that requires investment, moving together, guaranteeing health equity, and ultimately this is that health security to prevent any exposure and risk to pandemic issues and issues of natural and as well as man-made disasters. ICN's been very involved in the work on non-communicable diseases. As we think about the progress that's been made, we know that when we invest in the workforce and we invest in prevention of diseases or management of diseases that are treatable, we have a much better outcome. However, we also know that nurses face a challenge in addressing the NCDs, whether it's resources in a particular country. That could be everything from staff to equipment to the education that's necessary to really know how to best manage some of these conditions and get to the rural areas where we're able to address social factors and bring nursing care to individuals, whether it's the lack of technology that we know helps us, or the financial constraints. Nurses are addressing these barriers to being able to treat NCDs, and in many countries are doing a phenomenal job. So now is really the time for us to amplify our messages of how important it is to invest in nursing and the workforce and take advantage of the drivers of change. This is everything from digital disruption to addressing our workforce to recognizing that person-centered care is fundamental to how nurses look at our communities and the people we serve. And we know that nurses provide better value, particularly as we have looking at our workforce, not only our general workforce, but our advanced practice workforce. So we continue to reinforce the 4 areas of focus in the strategic directions for nursing and midwifery, starting with investing in jobs. We need investment in the workforce plans in our countries, and we must have a workforce across the continuum. The workforce needs the competencies in current education. We need to make sure that we have the regulations again in place that also support quality and help the public understand what nurses do. Nursing education, whether it's at the initial levels or continuing professional development, is critical. This is a principle we have always believed in and promote. We must have competency-based education. We must have the standards. And we know, again, that many of you are focusing on how do you shore up your educational systems, expand them so that we have specialty education as well as advanced practice education. We're supporting nurses directly, making sure that they have time to get this additional education, and that across the globe, as we learned in the initial State of the World's Nursing, we don't have a common standard for entry. We need to work on that. Leadership, again, a fundamental principle of ICN's knowledge and approach to saying if we want nurses to help change healthcare in this world, we must make sure that we have leadership and innovation. So we do provide significant mentorship and educational programs throughout all of your NNAs at a global level with partners to make sure that we are developing nurse leaders. This is an ongoing part of what we know is really important, and we encourage you to continue to focus on bringing your leaders, particularly through their work and advocacy, to be able to have that voice in terms of changing healthcare for the future. And we also know that nurses' well-being, which was severely compromised during the pandemic, is that fourth part of what's called service delivery in the strategic directions, but it's also the fourth part of what has been called the quadruple aim, making sure that we have a better patient experience, better outcomes, good cost structure so that people are not pushed into poverty, and caring for our caregivers. So this starts with workplace safety and protections, making sure nurses are prioritized for vaccination, have the protective equipment that they need, that our workplace has policies and guidelines and consequences if they are not safe. And that includes eliminating violence as well as any kind of inequalities. So nurses have an incredible amount of responsibilities and roles across the continuum of care, everything from prevention of disease, health promotion, through the full continuum of recovery. Nurses are there in every venue. We have always cared for vulnerable populations. We are doing more with your help to really understand and meet the needs of Indigenous people. Many of you are making great progress as you work together to make sure we're boosting the number of Indigenous nurses in our workforce as well. But this is everything from rural populations to addressing mental health needs, the aging of our society, and understanding all of the effects of vulnerable populations. Digital transformation is an important part of how we know we can do more with the resources that we have. We participated in discussions last year at the Commission on the Status of Women at the United Nations, reinforcing that we cannot leave nurses behind in digital transformation in this world. And it's not just the fancy simulation and artificial intelligence. It is implementation of technologies at point of care and in many of our places where nurses can really enhance our ability to track and treat individuals. So this is a really important time for all of us when we think about the opportunity for nurses to be able to do more in the delivery of primary health care as we are on our journey for universal health coverage, taking advantage of the advances in healthcare. And that's everything from digital technologies to working with our patients so they are informed. Addressing the workforce challenges has been top of our list now for the last couple of years. We must be able to get the investments of our governments to be able to fund the positions, to be able to fund the education that's needed so that we reduce the workload and have more individuals able to provide care. We know we're addressing the global challenges that are inherent in pandemics, the social crises, the conflicts that we're seeing, the financial hardship of people, and the continued mental health needs that far outweigh the workforce that we have. So this is where we want to leverage the power of our nurses with new and innovative models of care, which you'll be hearing more about as we move through this webinar. We must continue to increase the research base so that we are able to share what nurses are doing in evidence-based care. And we need to continue to have more leaders that are speaking to our authorities and our elected officials to get the resources that we need. So universal health coverage is really the place where nurses can make the greatest impact. It is everything from prevention to detection, humanitarian care, advancing our education, providing leadership, strengthening our workforce, and ensuring we have resilient health systems. Again, another fundamental part of achieving UHC. So thank you. I look forward to the continuing conversations and the information that our experts will share coming up shortly as we move through our webinar. I'd like to turn it out now to Howard Catton, who will talk to us about our policy work.
Many thanks, Madam President. Cyril, go ahead and put up the first slide, please. A little bit of history from me, colleagues. As I said, ICN has been active in this space, promoting and leading PHC for a number of years. Next slide, please. You will all know and be aware of the famous Alma Ata Declaration, signed in 1978 in Almaty, at that time part of the USSR, now part of Kazakhstan. And it very significantly signaled the shift from hospitalized and a medical approach to primary healthcare based public health, the importance of people within the context of their communities, respecting their rights, integrating all health care and ensuring equity in provision as well. 3 nurses from ICN attended that meeting in 1978. It's held between the 6th to the 12th of September. And I think many of us on this call will also be aware that the seminal definition of health not being merely the absence of disease or infirmity, but complete state of social and mental well-being, is contained in the Alma Ata Declaration. Significantly, this is one of the first times that we also see the economic case for public health being made. And in terms of being able to afford it, particularly poignant when I looked at it just in the last few days, that in the Alma Ata Declaration, the point is made that if the world was spending less on conflict and armaments, that would be an important way to free up resources for health care. Next slide, please. There's a lot of ICN work during the 70s and the 80s, particularly focusing on education and the development of nursing roles in community settings. This position statement in 2000 on primary health care reflected back on much of that work that had been undertaken, as well as making the links from nursing to health equity and the wider social determinants of health as well. This statement was reviewed and updated in 2007, and we saw ICN very clearly setting out how nursing is the very essence of primary health care. Next slide, please. 2008 was the 30th anniversary of the Alma Ata Declaration, and in that year, ICN focused its theme for International Nurses Day on primary healthcare, delivering quality, serving communities. There was a separate publication on nursing perspectives and contributions to PHC as well. That you're going to hear more about that work from ICN, because bringing to the fore examples of innovations in nursing roles and nursing models of care has been very much part of our work to show not just the dream of delivering PHC, but how nurses are doing that right now, right the way around the world in reality, and reinforcing and reminding people that we find nurses in pretty much every walk of life. You know, whether it be our factories, our schools, and our supermarkets, there are nurses, not just in our hospitals. Next slide, please. Coming a little bit more up to date now, you'll know, of course, that the Sustainable Development Goals were established in 2015, very much picking up on the ambitions of the Health for All commitment in the Alma Ata Declaration, the Global Development Goals established in 2015 to be delivered in 2030. But what was very clear to us at ICN was that nurses not only had a leading role in relation to SDG 3 on good health and well-being, but on very many of the other SDGs, whether it be, for example, addressing poverty, issues around employment, education, gender, of course. And this, what I think it's I think it's fair to say is a seminal publication that's referred to and cross-referenced a lot now to really reinforce and to highlight nursing's role right the way across the SDGs. Next slide, please. Of course, 2018 saw us at the 40th year anniversary of the Alma Ata Declaration, and it was clear that the world didn't hit the target of health for all in 2000, had a new target now for the Sustainable Development Goals of 2030, but needed a reconfirmation, a reaffirmation, a recommitment to the principles of Alma Ata and an updated declaration. Declaration was agreed at the Global Conference on Primary Healthcare in Astana in 2018. ICN again were there. This time we were also there with our colleagues and friends from Nursing Now, Nigel, Chris, Barbara Stillwell, and we worked together to ensure that in the new declaration, you can see on the right-hand side here, there is a very explicit commitments and statements in relation to the health workforce. It's not a long document, and you'll see that there's a section that stands alone, recognizing the importance of decent work, investment in education and training, and also the declaration picked up on the issue of ethical international recruitment as well. Moving on to 2019 and the next slide, we continued to put health for all, universal healthcare, at the forefront of our work. International Nurses Day resource, Health for All, Nurses a Voice to Lead, published in 2019. And again, new case studies that we brought forward in this to supplement the ones that had been in the previous INDs as well, to show how nurses were delivering, and that primary care is the gateway to the health system for many people right the way around the world. You've already heard the President mention the NCD Commission also in 2019, which also contained explicit references to the roles of nurses, non-physicians providers, unfortunately not the term that we would have chosen, but used to highlight and reflect just how important nursing roles will be to scaling up and delivering on NCDs. Next slide, please. So a number of resources you will be aware of, but to refer to, but we have been using those resources and the positions in those resources, next slide please, Cyril, to inform our work with WHO at the World Health Assembly, at WHO meetings, at the regional committee meetings as well, in relation to the importance of the nursing workforce. We've seen that, you know, people get the fact that PHC is the road to UHC, but they don't necessarily then join the dots to nursing as the people who will carry us along that road to our destination. And that is important for us to continue to do, to join those dots, not just from PHC to UHC, but from PHC to nursing. And we have been thrown off track by the pandemic. It's exposed a lack of preparedness, the increased inequalities, and that if we remain committed to our ambition of universal health coverage for all, we're simply not going to do that without investing in our nursing workforce. Next slide, please. And that's why when ICN published our Charter for Change, our 10-point plan this year as part of this year's International Nurses Day theme, celebrations and resources, we included this key point 6, that speaks to the health reform that we need to see, not only to enable nurses to work to their full scope of practice, but to reorientate and integrate health systems to public health, primary care promotion, prevention, community, home-based, and community care as well. Colleagues, you'll be aware that very significantly, the Director General announced at our Congress that we are about to start work on the next State of the World's Nursing report. That will then inform the next strategic directions, the global strategy for nursing and midwifery. I think this puts us at a place where it is a huge moment and opportunity for us to make sure that nurses' roles outside of hospital settings, in community, in public health and prevention, is showcased and highlighted much more in those forthcoming documents and publications. Finally, and next slide, please. Our president's talked a lot about the high-level declaration already, but just again, some of the words that are in that high-level political declaration for you to be aware of, to use, to reference. It talks explicitly about the concern of the global shortfall of healthcare workers, the need to train, build and retain, including nurses, our healthcare workforce, the social and economic gains from PHC, leading to the eradication of poverty and also the empowerment of women, girls, and reductions in inequalities as well. So said, very clear joining of the dots here from UHC to PhD to nursing, and a range of materials there, I hope, as well as the short history lesson, colleagues, so pointing you to a range of resources and materials that you can utilize and reference in your campaigning and advocacy work. I'm now going to hand to our chief nurse and our deputy chief nurse, to Michelle and David, to talk a little bit more about some of the nursing practice work and nursing roles that we've been supporting and promoting. Michelle, to you.
Thank you so much, Howard. Actually, Cyril, if you could kindly put up our slides, and our deputy chief nurse, David Stewart, is going to start us off.
Hello, everyone, and isn't it fantastic to see so many people from all around the world, all of the colleagues, and you start to see the vast number of countries joining us today. So thank you so much for being a part of this webinar, and it was just so enjoyable to see so many introductions. I want to be able to provide just a bit of a snapshot of about a couple of models that we see for reimagining of the health workforce. So I'm just going to wait for Cyril to bring up the slides there. I hope you've got them there. Have you, Cyril? Cyril, are you able to respond there? Okay, fantastic, fantastic. So if you go to the next slide, we're going to focus on some practical elements as it comes to the realization of achieving primary healthcare and universal health coverage. I wanted to start off, first of all, quickly looking at some of the workforce crisis. And availability is one of those big challenges. We know that across OECD countries and across the European region, that there's actually a 20% decline in general practitioners. And in some instances, when we look at the European Union region, there's about an estimated physician shortage of around 230,000 GPs. But also, if we look at some of the issues, particularly around accessibility of care, we recognise that a large number of the population is unable to receive the recommended tests that they require. And if we looked at, say, the acceptability of care, we see that only 60 to 80% of people report being involved in treatment decisions. This means that a large proportion of people do not have any say over their own health, and we don't see that as acceptable. But what about the quality of the workforce? We also see that a large number of nurses and doctors report being significantly overskilled for the roles and responsibilities that they have. Next slide, please, Cyril. And of course, there ends up being significant challenges placed on primary health care. And we see that patient safety is a growing concern. Often patient safety data and information is focused purely on the inpatient setting without focusing much in the primary healthcare sector. And actually, very little data is actually captured in many parts of the world on patient safety in this area. But what has been captured is very concerning. 4 in 10 patients are harmed in primary and outpatient healthcare. 5%, and this is of significant and serious concern, of adults in high-income countries experience diagnostic errors leading to potential harm. And 5 million deaths in low middle-income countries due to poor quality of care. But more than that, almost half the people experiencing in OECD countries have problems in their coordination of care, let alone issues around falsified medicines, which is estimated to be around about the 10% mark. If we move on to the next slide, Cyril. So we need to look at, well, what's nursing's role in challenging or overcoming some of these issues or challenges? And we're going to provide you with 4 examples. I'm going to touch on 2 of them before Michelle will take over the last 2 and then provide some concluding remarks. Next slide, please, Cyril. We know that, as I mentioned before, that navigating the health system is actually quite complex. They estimate that about $25 to $45 billion is wasteful because of poor coordination. As a result, we know that there is decreased utilization of appropriate funds. We've got high utilization of emergency department and inpatient admissions. It is estimated, for example, that between 20 and 30% of all ED admissions are done by just a handful of people, what we call here in Australia frequent flyers. And so what has often come up as a model to address this issue is nurse navigators, care coordinators, or case managers. And so when these roles come into play, they start to look at the data and the information, particularly around those that have come to the emergency departments quite frequently, to say, how can we address these issues better within the primary healthcare sector? Because a large number of these presentations could have been handled within primary care, but are unfortunately not. And so models that are being undertaken, say in Singapore, where they introduce chronic disease nurse navigators, have seen a significant reduction in emergency department presentations. Some studies have even suggested that for every $1 that is actually spent on care coordination on nurse navigation, there is actually a $5 return on investment. And so that's quite a profound model, looking at how to coordinate better the health system. Next slide, please, Cyril. But also, when we look at primary healthcare, around the world today, the traditional model of primary healthcare continues to persist. And what does that mean? Well, that means that it's a model that is more targeted towards the communicable diseases, short interventions with one provider, providing a short course of treatment and not needing any kind of follow-up. But as the disease pattern has changed to more chronic disease, we see the need for longer consultations and multidisciplinary teams. And so there's this desire to move from this traditional primary healthcare model to one that's more comprehensive, where the patient is more in charge of their own health and well-being. But it's not just doctors providing the care. It is now a whole multidisciplinary team involving multi-sector collaboration. And in fact, we see that when this model has been implemented, there are significant benefits. For example, in Costa Rica, when this model has been implemented, there was an 8% reduction in the need for emergency department presentations. And there was also an increased satisfaction rate amongst each of the providers. A similar kind of phenomenon was found when it was implemented in team-based care within Canada, where when this was implemented, particularly as it related to respiratory and other viral infections, that the productivity when working as a multidisciplinary team actually improved by around about 26%. So it's reimagining how we actually deliver primary healthcare in different settings. I'm going to pass over to my colleague, Michelle, who will look at 2 other particular models as well.
Thank you so much, Dave. Excellent presentation. Can I have the next slide, please, Cyril? And wishing everybody a great day. Virtual greetings to all of you. And it was just wonderful to see so many of you in Montreal. So let's get talking about nurse-led models of care. We know that nurse-led primary healthcare clinics provide comprehensive care, often in primary care settings. They address gaps in healthcare, especially in the underserved areas. And their health services range from any non-communicable diseases such as diabetes and chronic care and wound care as well. Community-based primary health care models, nurses work directly with the communities that they live and enjoy their citizenship with to improve health outcomes as well. They tailor interventions based on the community needs And they have collaborative approaches that involve stakeholders to serve populations such as schools or prisons or hospices as well. In home-based primary health care models, care provisions occur directly in people's homes. They're suited very well for frail elderly, those with chronic illness, and post-operative care, for example, as well. And they reduce hospital readmission rates and support independence as well. For nurse-led health promotion and prevention models of care, they focus on educating the public on health and wellness. Nurses offer workshops, seminars, and health fairs, for example. Nurses target risk factors for disease reduction and promoting healthy lifestyles, and they play key roles in preventative measures such as nurse-led vaccination programs, early detection of and screening for various health conditions as well. Health counseling and education prevent disease onset in primary care models here. Next slide, please. Nurses offer workforce solutions in primary health care. Many OECD countries report fewer physician graduates selecting primary care as their chosen career, and we know that there's global health workforce shortages, including physicians in primary care as well. This often results in breaches of the World Health Code of International Recruitment Practices as well. When we rationalize services, this is the lived reality. We can increase public payments for services, which is a common solution, and this leads to affordability issues, creating a two-tiered system. The marginalized and poor are often left without care access, and specialization does not necessarily improve access to comprehensive care. Advanced practice nurses, like nurse practitioners and clinical nurse specialists, enhance healthcare access, and they're proven to safely and effectively increase healthcare access. Health professionals, including pharmacists, for example, also contribute significantly to expanding primary health care and team-based care as well. There's a great case study in the United States who has more than 50 years of experience with nurse practitioners in primary care. The nurses have demonstrated they're able to fully optimize their scope of practice, and they're well accepted by patients as well. Over 36,000 nurse practitioner graduates a year result in 90% being prepared and certified in primary health care, with about 70% or another 200,000 of all nurse practitioners delivering primary health care. This workforce is expected to double in the next 15 years. The current ratio of physicians to advanced practice registered nurses is 2-to-1, and it's expected to shift to 1-to-1 by 2032. The American Medical Colleagues workforce modeling suggests that 50 to 77% of physician time by advanced practice registered nurses. And this modeling assumes that physicians would focus on more complex care. Next slide, please. Advanced practice nurses, as you may or may not be aware, I'm a primary healthcare nurse practitioner as well, and I continue to practice delivering primary healthcare for health equity seeking populations as well. And primary healthcare advanced practice nurses have specialized education. I would like you to review the ICN Advanced Practice Guidelines. Most are at a master's level of education, and they can diagnose, treat, and prescribe and provide comprehensive care. Advanced practice nurses improve access to care by working closely with vulnerable populations in remote rural areas. In Ontario, Canada, where I live, we actually have 25 nurse practitioner-led clinics, which broadens the reach of primary healthcare services. And we all know that telehealth services is just amplified for reducing barriers to care for in-person care, especially from COVID, and they can improve access to care as well. Improving health population is key with chronic disease management, monitoring, and interventions, and health promotion and preventative screening, such as immunizations. We can focus on truly holistic care in primary health care, and that is the mental and social well-being as well, including enhancing work like healthcare providers, which is key for retention. We know advanced practice nurses stay and are retained in the workforce longer and have career pathways that all nurses should enjoy. Cost effectiveness of primary health care is evidenced by reduced hospital admissions through primary care, lower costs of service provisions as well, and decreased unnecessary medical tests and procedures as well that are all evidence-based. Why? We want to improve the patient experience, and this is valued. More time per patient consultation, personalized, person-centered, person care approach, and consistent follow-up leads to trust and a rapport as well. There's a great case study in the United Kingdom, a randomized controlled trial involving 181 patients with rheumatoid arthritis, where they found the average cost per patient on clinic consultations was $62 less than in the advanced practice nursing group compared to the physician group as well. Next slide, please. When we talk about prescriptive authority for nurses, I urge you to look at the ICN prescriptive authority guidelines as well. We know they're safe and effective. There's rigorous education and training to ensure safe prescription practices as well. And there's evidence-based approaches to medication management. This is paramount for safety, and nursing prescribing also improves efficiency by reducing wait times and streamlining care delivery as well. There's variability in preparation, as we know, with different education and pharmacological competence, but standards can differ by region or institution, and country context is important as well. But if nurses can't prescribe, it can lead to a break in care continuity. Patients may face delays in receiving necessary treatments. Various levels of prescriptive authority exists, all the way from fully independent prescribing, others with collaborative agreements with physicians or with nurse practitioners, and some areas restrict the type of drugs or sectors you can practice in as well. Prescribing is not limited medications alone as well. This can include wound care, special dietary restrictions, medical devices, and specialized equipment as well. Last slide, please. In summary, I'd like to thank you. A recent publication was just drawn to my attention. Congratulations to our AFRO primary healthcare colleagues on their publication. I urge you to look at that. And just to reiterate, the nurses have the knowledge, competence, expertise, and leadership to accelerate progress towards universal health coverage and optimize access to primary health care. If we invest, progress, and monitor implementation of primary health care, it's paramount. And I encourage you all to review the ICN education modules on patient safety, as well as the global strategic directions for nursing and midwifery, where for primary health care, education, service delivery, meaningful jobs, and leadership is paramount. I'll pass the virtual mic back to our president. Thank you.
Thank you, Michelle and David, and thank you, Howard, too. So we have heard a number of scenarios where there are measurable outcomes, which is really critical to looking at the importance of nurses and primary health care and this journey toward universal health coverage. So very powerful statements about the impact of nurses, which is why we not only are justified in asking for greater investments, but really bringing to the forefront why this is so important and why now. In the next half hour, we're going to hear from a number of our NNA representatives who are going to share the contributions that are happening within their areas toward UHC. And I look forward to hearing also your questions. That there are no questions yet in the Q&A box. So as you are listening and thinking about things you might want to put forward to all of our panelists, please go ahead and enter them into the Q&A. For our speakers now coming on, you have 2.5 to 3 minutes. You will get notified at 2.5 minutes that your time is coming to an end. So we hope that you'll be able to adhere to those timeframes. So first on our list is Kerry Nuku from the New Zealand Nurses Association. Kerry, the floor is yours.
Kia ora koutou katoa. Kerry Nuku, the Kai Whakahaere for the New Zealand Nurses Organisation. It's a pleasure to be here, and thank you very much for the presentation. I think what we've found in New Zealand is absolutely primary healthcare and universal healthcare is the key to ensuring equitable services delivered to our populations and community. Our organisation has realised that we've gone through some significant, as a small island country, we have gone through some significant traumas in the last year. With the impact of Cyclone Gabriel, we've never had natural disasters as such. So it has required of us to rethink the way that we plan our care, to rethink the way that we practice. And our organisation has developed a strategic plan called Maranga Mai. It's a comprehensive strategy that does a number of things. It looks to call together nurses in their collective. It looks to allow nurses to take the lead and to take and make some political decisions to ensure that nursing voices aren't silent at the table where decisions are made, that there is an ability for nurses to collectively influence health outcomes by being part of the policy decision makers. That's a significant shift because for many years, our nurses have felt or begged to be at tables, however, not been proactive enough to make those decisions. So one of our strategic plan is to ensure that we have nurses everywhere standing up. That is the meaning of Maranga Mai, to stand up and take action collectively beside primary healthcare, community, and the hospital sector. So collective working together. We've also developed strategies that look at the Indigenous health and wellbeing, so that alongside any policies that we're making or involved in, that we critically apply a cultural lens to ensure that no Indigenous population is left behind, and that the voices of Māori as tangata whenua and of Pacifica, who are always overrepresented in poor health outcomes, are never far from policy decisions. As I've said, we've had significant impact due to these natural disasters.
30 more seconds.
It has made us look at how we critically involve communities into the decision making. What we've found is that further and further decisions are made further away from consumers. So involving them in the decision making, connecting up again with nurses, ensuring that our equity lenses apply to everything that we do is part of what we've got to make as natural and normal. Kia ora.
Thank you very much, Carrie. You really have identified, again, key principles of how nurses need to be able to influence decisions. It's being at the table. It's not being silenced. It's taking the equity lens and really empowering your nurses. So it's exciting to hear about this new strategic direction. And if you would put in the chat the name that you stated, so that we understand how it's spelled and pronounced, that really is terrific. Thank you so much. Okay. Our next speaker is Yukari Nakano from the Japanese Nurses Association.
Thank you, Madam President. Good morning, good afternoon, good evening, everyone. I'm Yukari Nakano, Executive Director of the Japanese Nursing Association. Japan is recognized as an early achiever in universal health coverage, and at the same time, it is a leading country in terms of challenges. As you know, the rapid aging population with a declining birth rate is causing a significant impact on the health issues in terms of both quantity and quality. At the same time, it is causing institutional challenges how the system can be sustained. With such a recognition, Japan has been promoting healthcare policies for about a decade against the rapid increase in the elderly population, aiming at 2025, when the aging problem will become quantitatively more serious. Around the same time, the JNA published Vision for the Future of Nursing for 2025, setting the roles of nursing in protecting and supporting the health, life, and dignity of all people living in the community, from both the medical and life perspectives of nurses. Over the past 10 years, we have been working to achieve this vision through better education, practice, and leadership development, and expanding the field of nursing and stimulating activities in local community. After 2040, when the elderly population will peak out, we will not only see further declining birth rates, super aging, and population decline, but also qualitative changes in the elderly population. Health disparity will widen, and local administrative functions that support people will weaken. The challenges we must address will become even more serious. The JNA is currently working on a new vision based on the discussion on the social issues in 2040s, as well as on guidelines for initiatives after 2025. Healthcare systems in Japan have focused on responding to diseases after they have appeared, and a large amount of social security fund and healthcare resources have been invested in treatment. On the other hand, resources for health promotion and disease prevention are not sufficient. The JNA believes that a system
30
to
more
maintain
seconds.
and promote the health of people in the community will be more important in the future, and aim to create nursing activity centers that fulfill the primary healthcare functions, such as a nurse-led model. More resources and funds should be invested in such area. We believe that such enhanced primary healthcare by nurses will contribute to the efficient use of healthcare resources and funds. Finally, we strongly emphasize that without nurses and primary healthcare promoted by them, the UHC can never be achieved. The JNA will continue to effort to achieve UHC that meets future social and healthcare needs in Japan, and to promote global UHC. Thank you.
Thank you very much, Yukari. Again, I think it really helps to reinforce how important it is to be planning for the future. You have been sounding the alarm about the aging population and lead the world in terms of the percentage of people there who are elderly. But I think stressing once again that it is care in the local community that will help lead us to increasing primary health care and addressing these concerns. The other growing concern that was mentioned that I think others want to be aware of is the declining birth rate, that in many countries, this is now going to be a challenge. It is not just Japan. So thank you for raising that.
Thank you.
Our next speaker is Ying Wu, former board member of the National Council of Nurses. Happy to welcome you from the Chinese Nurses Association.
Thank you, Madam President. Dear colleagues, I'm Ying Wu, representing the Chinese Nursing Association and professor and the former dean of the Capital Medical University School of Nursing. It is my great honor and privilege to share insights on how China's nursing community is contributing to achieve UHC through innovation of digital nursing, particularly through AI-empowered digital nursing. Now, China has a high internet penetration rate and smartphone users, as well as social media. WeChat, a social media platform in China, has more than 1.3 billion active users across the country. Due to its multiple functions, WeChat is more than just a social media. It has become an indispensable part of daily life for the majority of Chinese people. And it also offers features like mini programs, which provide a straightforward and accessible platform for developing various applications. So as a result, nurses and the nursing researchers have harnessed the capabilities of WeChat and the WeChat mini programs to conduct remote health and patient management, including post-discharge follow-ups and the management of chronic diseases, etc. By searching the literature, it reveals about 2,000 published papers regarding nurses in China use WeChat or develop health and patient management tools using WeChat mini programs. These initiatives have significantly increased patient follow-ups rate, improved management of chronic diseases, and enhanced healthcare accessibility for rural and remote areas, ultimately contributing to the achievement of UHC 2030. Furthermore, many nurse researchers have developed more intelligent mobile health management systems. For instance, my research team has developed several intelligent mobile systems. One of them is for managing patients with CVDs. Through this system, we can assess and monitor their conditions and the control of risk factors remotely for patients across
30 more seconds.
And provide interventions accordingly. This approach effectively achieves secondary prevention and reduces CVD risk factors, therefore reducing the incidence of ischemia events, ER visits, hospitalization, and mortality. So with the success of ChatGPT, it has provided us with a methodological foundation to develop even more intelligent digital nursing health. So we are currently working on developing ARGC empowered chronic disease management system, aiming to further enhance the intelligence of digital nursing and amplify its impact on achieving the UHC 2030. I thank you all.
Thank you very much. You've really shed light on the power of the digital transformation that's occurring, not only on the part of the nurses and other healthcare practitioners, but clearly infiltrating your public and making sure that as they are internet users, that they see the benefit and can communicate with you about NCD management, as well as being able to boost the contact that your researchers have. So thank you very much for sharing that. Our next speaker is Marcel Scal from the France Nurses Association. Please go ahead.
Thank you. Je m'exprime. I will speak in French. L'Amphide remercie chaleureusement l'ICN pour l'opportunité.
I would like to thank ICN for giving us the possibility to take the floor today. In France, primary health care does not depend on a hierarchy, and the thing is that we still don't use that much in our profession because the Astana definition is still too wide, and then because we have the Hôpital Patient Santé Territoire law in France from 2009, and unfortunately this means that physicians are key and impressionable in France. What's more, we have understood nowadays that nurses are key, and actually the pandemic has reshaped everything, and today the legal framework is evolving, and today they understand at Parliament that shifts are needed. What's more, we take part in the development of new care models where nurses can contribute more to efforts throughout our country. Furthermore, we support a new organization in line with the government's objective stemming from a new law from 2016. As a consequence, we are working with all practices with new protocols and with the new funding law of 2018. We today understand that nurses have a lot of potential, that they can help people, and that they are to be invested in for community care. Our body has been identified by the Ministry of Healthcare to work on nursing. And today we promote competences, good practices in line with the needs of citizens. We work on training and so on and so forth. We are also deeply involved in prevention at the primary level with inoculation, with the WHO. We also work at the second level with chronic diseases, and we also work on the third level on prevention. Our organization is also deeply involved in France in other activities in order to widen the activities nurses can carry out, namely when it comes to cancers. We have been working with patients for many years and have a true partnership with a French organization representing patients, and we defend patients' rights as well. We have a proactive policy in order to widen the care of citizens with the government. And I do thank you for your attention.
Thank you very much for once again highlighting how important the investment in community-based care is, so that you're able to do primary prevention as well as secondary prevention across a range of communicable and non-communicable diseases. So thank you for that. Let me just make a comment. Several people have put in the chat that they were not aware of translation. Please go to the bottom of your screen where there is the ability to make that change to whichever language. We have English, French, and Spanish, so that hopefully you are able to hear everyone firsthand. So thank you. Okay, our next speaker is Pamela Marie Noel Gaspard from the Mauritius Nurses Association.
Greetings to you all. The public health service in Mauritius are designed to achieve universal health coverage. The primary healthcare network comprises of 18 area health centers and 116 community health centers, 5 mediclinics, and 2 community hospitals. Out of total number of human resources for healthcare, 40% is the nursing and midwifery personnel. Despite the remarkable health achievements accomplished, Mauritius faces many challenges, which include the growing burden of non-communicable diseases, the complex health needs of the aging population, and the rising expectations of patients for more patient-centered and improved quality of care. The Mauritius Nursing Association has played an important role in influencing policy and has collaborated with the government in the development of the health sector strategic plan. While building on the health gains already achieved, the health sector strategic plan unveils concrete strategies and interventions to address major health challenges in the country and people's expectation for an enhanced quality of services across their lifespan. It provides a coherent framework that will guide policymakers, stakeholders, and partners in health development over the next 5 years. The strategic plan proposes a comprehensive set of actions to re-engineer and revamp our health delivery services with a lot of emphasis on customer care, enhancement of primary health care, health promotion, preventive medicine, specialized services. Nurses play an important role in Mauritius in achieving these strategic actions, which include the encouragement of early detection of breast cancer and cancers of the female reproductive organs through increased access to screening services at the primary healthcare and community levels. The scaling up of HPV vaccination coverage among adolescent girls, the setting up of a menopause clinics in gynecological and obstetric departments of all hospitals, strengthening awareness among targeted groups of the population of the consequences of backstreet abortion and its adverse effects, undertaking screening for early detection of intimate partner violence, and making hospitals and other healthcare services more user-friendly for the management and clinical cases related to domestic.
30 seconds more.
Yeah, the future of nursing relies on effective use of population data to plan nursing workforce. Actually, in Mauritius, there is an acute shortage of staff. There is also a need for specialized education at the post-graduation level, and digital health still remains a key challenge in Mauritius. Thank you.
Thank you very much, Pamela. Again, highlighting how important it is to have nurses involved at the policy level to be able to help formulate these strategic plans for the utilization of nurses in delivery of more services. Thank you very much. Okay, next we will hear from Jingmin Chen of the Taiwanese Nurses Association.
Thank you. Yeah, this is Jingmin Chen, President of Taiwan Nurses Association. Thank you for the opportunity to share my country's experience. In Taiwan, the government started to implement the national health insurance for our 23 million citizens in 1995, while only half of the population was covered during that time. After 20 years contribution, I'm pleased to share that our health coverage now has reached almost 100%. In addition, our government has initiated 3 investment and 6 actions in nursing since 2018, aiming to strengthen our primary health care and ultimately to help fulfill the goal of UHC, which include invest in home health nursing, effective nursing, and smart nursing. And the 6 actions are to reimburse the nursing service in long-term care payment, initiate community-based family nurse practitioner system to serve in remote areas, invest nurse leader to serve at the advisory committee at the National Health Research Institute in order to make health and nursing policies, implement the advanced practice registered nurse accreditation system, establish tailored healthcare service in remote area, and finally monitor national nursing workforce, cross-integrate data sets. However, after COVID-19 pandemic, like some other countries, Taiwan also encountered serious nursing shortage. Our health authority, Ministry of Health and Welfare, has established that we will need an addition of 55,000 to 74,000 nursing manpower by 2030. To cope with the problem and prepare sufficient number of skilled nurses, the health authority has set several proactive nursing workforce policy, including working with hospital to implement effective retention measures, collaborating with Ministry of Education, Ministry of Examination, and nursing schools to increase our examination pass rate, as well as investing more resources in nursing education to attract more nursing students. And some more other interventions, including setting standard of 3-shift nurse-patient ratio, pay raise, and positive working environment, and skill mix care models, and so on, are also being seriously considered and planned to be funded by the government. In conclusion, if we are going to fulfill the nursing policy goals mentioned above, the health authority estimate that the budget of US 2.5 to US 3 billion per year will be needed. So we believe it will be a challenging road in front of us, but we are heading to the right direction. And that are all interventions we like to share. We appreciate any feedbacks and comments. Thank you.
Thank you very much, Jimin. I think you've, again, highlighted how important it is to have investment in the workforce planning, in addition to the amazing work you've done in insurance across the country. But these workforce projections, and they translate into workforce policy, are going to be critical to restore that workforce. So thank you for sharing that. Okay, next we will hear from Roxana Hanaciu from Romania.
Thank you, Madam President. Greetings to all colleagues. So thank you for the opportunity to address this special event on primary healthcare on behalf of the Romanian Order of Nurses and Midwives. And we are pleased to share our insights and underscore our commitment to nursing. One of the critical aspects of achieving universal health coverage is definitely the investment in primary healthcare. And nurses are at the forefront of this effort. And I would like to highlight some key strategies that Romania has put into action for the reform of primary healthcare in our country. So first, prioritizing screening and prevention, which centers around increasing the focus on screening and prevention at the primary healthcare level. We firmly believe that prevention is not only the most cost-effective, but also leads to better patient outcomes. And we have provided incentives for primary care practitioners, including nurses, to actively participate in prevention programs, encouraging them to take on a more active role in the overall health of our citizens. Our second key strategy entails substantial efforts to improve the infrastructure and capabilities of primary healthcare facilities. We've increased remuneration mechanisms for primary care cabinets, which include both physicians and nurses, to make them more attractive for healthcare. Additionally, we have launched an investment program that has equipped 3,000 primary healthcare practice with modern equipment. Nevertheless, it's not solely about infrastructure. So we are challenging healthcare professionals to step out of their comfort zone, encouraging them to expand their roles and prescription rights. It's essential for them to embrace a more proactive and holistic approach to healthcare. And we remain committed to working closely with the Ministry of Health of Romania to expand the roles of nurses and midwives in delivering improved healthcare to our communities. Community-based care often serves as the first point of contact for patients, and by empowering nurses in this role, we can guarantee improved health outcomes for all. And this leads me to a fourth key point that I would like to share, which is strengthening the health workforce and local partnerships. We've revised the payment mechanisms for nurses along with doctors practicing in the rural areas to make these areas more appealing to healthcare providers. And recently, our regional conference, organized with the support of the WHO office in Romania, gathered the local stakeholders and experts
30 more seconds.
To concentrate their efforts on empowering nurses to provide care at the community level. Additionally, we must adapt to evolving landscape of healthcare by embracing digital health innovation, and we have invested consistently in this area in Romania. And we invested in an integrated database registry to allow for better evidence-based policies for health workforce. And we are very proud to have been at the forefront of a comprehensive consultation that has concluded last week in Astana, the UHC2030, with the adoption of a political resolution framework for action on healthcare workforce in the WHO regional European region. This resolution is an essential step towards implementation of the commitment taken through at the Bucharest Declaration on Health and Care Workforce, adopted earlier this year in May in Romania, and where the nursing community played a fundamental role. So thank you. Thank you, Dr. Catton, for being in Romania at that time, and thank you for this opportunity.
Thank you, Thank you, Roxana, for again reinforcing nursing's role in integration into the databases, in making sure that we are focusing on prevention and bringing nurses' voices to the forefront, and particularly as we are advocating for the workforce improvements that you recommended. Investment in that workforce planning is really critical. So thank you for sharing that. Next, we will hear from Dilip Kumar, President of the Indian Nursing Council.
Thank you, Madam President. Thank you very much for giving me the opportunity to share how in India, the Indian Nursing Council is working towards universal health coverage. The government of India has given a high priority for providing the universal health coverage to achieve the Sustainable Development Goal by 2030. In that perspective, under the Ayushman Bharat, under the leadership of the Prime Minister, all the sub-centers which caters to a population of 5,000 in plain area and 3,000 in hilly and tribal area, all these 150,000 sub-centers have been converted into health and wellness centers. And these health and wellness centers are having a very important component of the nursing by positioning as a nurse as a community health officer. And this community health officer their qualification has been prescribed to be a graduate nurse, that is the BSc nurse. So in order to have a more the community health officers, especially we have taken the policy decision of integrating the role of the community health officer in the existing BSc nursing curriculum. So that legal regulation has been formed to ensure that the component of the community health officer has been integrated into the BSc nursing curriculum. And also the Indian Nursing Council also has revised the basic BSc curriculum to convert it into the competency-based training program to improve the quality of the nursing education. So in that, we wanted to train all our faculty members in the simulation. We have established the state-of-the-art simulation center to train our faculty members in the master level simulation center, so that they will be able to provide at the competency-based training program in the existing training program. And in that perspective, also we have also nurse practitioner midwifery in the advanced nursing practice. The nurse practitioner midwifery program has been approved by the Government of India and the Indian Nursing Council in collaboration with the Ministry of Health, has come out the nurse practitioner midwives, and it has been estimated 84,000 nurse practitioners midwives need to be trained.
30 seconds more.
So, and also the leadership is also one of the important. So we have brought the LFC, state-of-the-art LFC training program, the ICN, to India to train the 40 LFC and train people. They are going to take further into train the many more leaders in the country. And the existing one of the legal framework which is required for effective performance of the nurses and midwives in the rural area, the scope of practice, which was not there in our existing act, it has been brought to the new Nursing and Midwifery Commission, which has been approved by the Parliament recently. So this will give us scope for the National Nursing and Midwifery Commission to take the policy decision with regard to the scope of practice, which will go a long way for providing for the nurses and midwives to achieve the universal health coverage. Thank you very much.
Thank you, Dilip. The partnerships that we all have with our regulatory bodies is absolutely critical. You've highlighted not only the curriculum issues and moving to competency-based education, but clearly the scope of practice and again, working together across all of our partners to make sure our faculty are trained and that we're doing the leadership program. So thank you for raising those critical accomplishments. And I want to thank again everyone for making sure that we have focused on all of the great things that you're doing. We have one last speaker who I know will add additional insight, and that is Ellen Koo from the College of Nursing in Hong Kong.
Thank you, Madam President, and good afternoon from Hong Kong. And I would like to share a few things from Hong Kong. First of all, I would like to share with you what have we done about primary health care. So actually, we have a different project going on. And since 2018, our Department of Health start the document towards 2025 strategy and action plan for prevention and control of NCD, which is public education, opportunity to promote healthy living. And then to 2019, we have the first district health center as launched, and with the expectation that each district in Hong Kong will have a healthcare center so that people will we have a community health center. People don't need to go to hospital and start to introduce the concept of primary healthcare and put it into action. With this in hand, the government established a primary healthcare office under the Health Bureau, and then a primary healthcare blueprint was published in December 2022, and which have a booklet here. I hope you can see it. But there is one point I'm going to talk to our commissioner of this primary healthcare office. One of the key point is what is primary healthcare written here is family doctor for all. And I think I will propose them to put it family doctor and nurse for all. And I think that will be the concept. And in 2023, October 25, our government announced the policy address. One of the items on health is Healthy Hong Kong, which has different categories for all walks of life, from reproduction to elderly services. But one key message is we bring the health services to the community and promote aging people in the city. So there is a lot of new ideas and perspective in this area, but it is a challenge for the healthcare
30
system.
more seconds.
Yeah. And for nurses, most of the training right now is based on the traditional model and not much about primary health care. So nurses are not well prepared. So we are talking about there will be a revamp on the educational curriculum. And the other is since a shortage of manpower, shortage of nurses has been a question in Hong Kong, And then there is, because of the promotion of healthy life in the community, so there is another stream of education and development to have the healthcare workers. They are trained, and then, but they are not going to practice as nurse, but they are going to take up part of the works in the community. So I don't know whether it is a threat or a good advantages for the nursing development in Hong Kong. And then we also reviewed the nursing ordinance recently, and that will be more easy for overseas nurses to practice in Hong Kong. The other challenges is with the development of different service area, and the technology development is a very hot topic to talking about. One is the healthcare record. How can we bring the health record to all the centers and all areas? And
yeah, Ellen, I'm going to have to ask you to end so that we can conclude our webinar.
Okay, I just finished it. And there is a lot of opportunities for nurses to learn here in Hong Kong. I would like to invite some of you to come and talk to us, the Hong Kong nurses, about the primary healthcare development. Thank you.
Again, thank you very much. And I love your suggestion of saying that it should be a family doctor and nurse for all. So thank you. So we have had really excellent presentations to bring us all to the understanding of the amazing work that's being done in many of our countries and organizations to promote primary health care and the role of the nurse, and be able to address that through regulation, through policy, through workforce planning. I've taken a quick look at all of the questions that have come in, and there are some general themes. Because we're out of time, we won't have the opportunity to answer those questions. But so let me make just a few general comments. The questions really deal with almost every issue we've touched on this webinar, whether it's protections of our workforce, protections of our people who are in conflict areas, gaining investments, specific question on the Abuja Declaration. This is very consistent of saying we must invest in our people, we must invest in healthcare. We consistently find that nations are behind in meeting those targets, but it doesn't mean that we stop pushing. So both in our Charter for Change and the political declarations coming out of the United Nations, and particularly the UHC2030, it is about high-level commitment and investment and action. Similarly, our discussions about the roles of nurses, one of the questions focusing on how can nurses help with prevention so that we reduce the unintended mortality, premature death of individuals with non-communicable diseases. These are the fundamental places where nursing makes a difference, and where ICN has focused on providing resources. So questions have come forward about, what can ICN do to help? One of our primary goals, again, is leadership development, but also providing you resources. As you heard Howard mention, we will have a guidance document that is more specific to primary health care and universal health coverage. We encourage you to use all of the resources at your disposal from ICN, and we will continue to make this a significant focus as we continue to focus on our Charter for Change to shore up our workforce and overall investments, as we promote the political declaration, almost 80 action items to make sure that we are linking health security to UHC, to the role of nurses in primary care, to the outcome of health for all. So we will play a significant role together. And thank you for those of you that have shared your existing examples of how you are already making an impact and having influence. So I want to thank everyone for your participation today. We usually do post the webinar for our members to be able to access afterwards. And I will ask if there's any additional insights or concluding remarks from Howard or anyone else on staff before we close the presentation. We're good. Okay. All right. Again, thank you everyone for joining us today. We appreciate your listening as well as participation and comments as we have gone through the webinar. Thank you so much, everyone, and have a wonderful rest of your evening or your day ahead. Thanks.